Okay, so as chair of this study and of this committee meeting, I would like to welcome everyone. And I really don't have the words to express how enthusiastic I am that all of you are here. The task that's being undertaken by this committee for the National Academies is to evaluate comprehensively the current criteria for the diagnosis of myalgic encephalomyelitis chronic fatigue syndrome, which is indicated on the information sheet that has been handed out. I would also like to give some sense of the format of today's meeting. We will begin this afternoon session with the presentation of the charge to the committee by the study sponsor's representative. Following her presentation, the committee members will have time to ask questions about the statement of task. After this question and answer session, we will hear from representatives of several federal organizations that have been working on different aspects of ME/CFS. And following these presentations, we will hear from 7 advocates and associations on ME/CFS. We will close this session with a 45-minute public comment session. I want to point out that this is an open, on-the-record session. Interested individuals and members of the press have been invited to attend as observers. This is not a news conference, however, and we will not be entertaining questions from the floor. Reporters who would like to talk with members of the committee are kindly asked to touch base with the staff at the National Academies Office of News and Public Information, Molly Galvin, who's over there, and should plan on doing so during a break. I would also like to remind people that this is an information gathering session. That is, that the committee is just beginning the process of assembling the materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone today to be extremely mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the National Academies. Those positions will only be available in the final report. In addition, committee members do ask probing questions in the course of these information gathering sessions, which may not be indicative of their personal views or the views to which they will come after this intense deliberative process. The committee will deliberate thoroughly before writing its draft report. And as you've already heard, it goes through rigorous review. I can't tell you how rigorous this is, but it pales to everything else pales in comparison to this, who are anonymous to the committee, and they must respond to the review before it finally becomes a product of the National Academies. Our first speaker today will present the study's statement of task, as well as engage in question and answer with the committee members to help clarify or solidify the charge of the committee. I will begin by introducing our first speaker, who is Nancy Lee, a designated federal officer for the Chronic Fatigue Syndrome Advisory Committee, Deputy Assistant Secretary for Health in the Department of Women's Health. Well, she's up there, so I'm going to stop talking. Okay.
Go ahead.
And Director of the Office on Women's Health in the Office of the Secretary, U.S. Department of Health and Human Services. Thank you, Nancy.